One of the most critical factors to maintaining a healthy heart is our diet. By paying attention to what we put into our bodies, we can significantly reduce the burden put on our heart and go on to live our lives without restrictions. Our heart works hard to distribute oxygen-rich blood throughout our bodies, but if it works too hard, it may become overstressed. It's our job to do what we can to help our heart by minimizing the extra stress we put on our heart. One way we can do this is by managing our diet. One easy action we can take as part of a heart-healthy diet is to reduce the amount of salt we consume. Salt acts like a sponge, holding on to extra water in our body. You may ask yourself, why is this a bad thing? Consuming water is not a bad thing. In fact, it's a very good thing. But like so many things in life, we want the right balance. We only want enough water for our body to function as it is supposed to, and to send our brain the message that it has enough water in reserve in case of an emergency. Too much water in our body leads to extra blood running through our arteries, the tubes that carry blood and oxygen from the heart to the rest of the body. Increased water in the arteries means increased tension on the artery walls. This increased pressure can eventually lead to damage in the arteries, just like overfilling a water balloon can cause a balloon to rip or rupture. Damage to the arteries can have a significant impact on your life, as it makes your body less effective at transporting important nutrients that help you be active and live a normal life. A good first step to reducing or limiting the amount of salt, also known as sodium, that we consume is understanding the sources of salt and choosing to consume foods with less salt. Salt is found in more places than the shaker on the table. Often, salt is hidden in other foods. Processed foods like chips, cookies, deli meats, soups, and pizza are all common sources of these hidden salts. Reducing the amount of salty snacks we consume is a quick way to reduce intake. Eating more fruits and vegetables like apples, carrots, and broccoli, which have extremely low amounts of salt, is another way to do this. Fresh meats, poultry, fish, eggs, and yogurt are all great sources of protein that have less salt than many popular snacks. Rice, pasta, oatmeal, and legumes are great forms of carbohydrates with lower salt content that can provide your body with the energy it needs. Another simple step is to make small changes in the foods we currently enjoy by opting for lower salt variations. There are low-sodium versions of common food items like soup, pasta sauces, condiments, and frozen meals. We can continue to enjoy packaged goods, but we should ensure that they have lower levels of sodium. If we look at the nutrition label on the back of the package, we should aim for foods that have less than 350 milligrams of salt per serving. A quick tip is to check the listed ingredients. If salt is listed as one of the first 5 ingredients, then the food item likely has too much salt. In order to ensure that we are staying within a healthy range of sodium consumption, we should aim to consume no more than 1,500 to 2,000 milligrams of sodium per day. Another action we can take as part of a heart-healthy diet is to be mindful of the amounts of fat and cholesterol we're consuming. There are 2 types of cholesterol, LDL, or bad cholesterol, and HDL, or good cholesterol. Simply put, LDL is associated with heart disease because of how easily it builds up in the walls of blood vessels. Consuming a lot of saturated fat causes buildup of LDL cholesterol in our body. Think of this like gunk building up on the inner walls of a pipe. Eventually, this can lead to a clog. We do not want LDL to build up because it constricts our blood vessels, making it difficult for our body to transport nutrients that fuel our activity. To reduce the saturated fat and cholesterol levels in our body, we should avoid fatty cuts of meat, especially red meat. We can even trim off the visible fat from cuts of meat as a precautionary measure. We can also make changes in the way we prepare our food. Rather than frying food, we can bake, broil, boil, or steam it. When we cook, instead of cooking in solid fats like butter, shortening, or hydrogenated oils, which are high in amounts of saturated fats, we can instead cook with canola oil or olive oil. Watching our fat and cholesterol intake and reducing our salt consumption does not mean we can't eat out. We can substitute fried chicken for the grilled, baked, or broiled options since these have much less salt. Foods like mashed potatoes or fried rice can be replaced with steamed rice, baked potato, or plain noodles. While fast food can be a tasty treat, continue to be mindful and consume in moderation. As we pay more attention to our diet, it is important to remember that we can continue to eat the foods that we love while also making slight modifications that keep our heart healthy. These small changes can make a huge difference in allowing us to be active and do the things we love each day without worry.